Oh, hi, everyone. So obviously we're not Sally Lasky. Sally is out and had asked Mo and I to facilitate this meeting today. So we're happy to be here. Let me go ahead and just tell you a little bit about the Zoom info. So obviously, yes, we are recording the meeting. And as you know, Sally then will make those recordings available to everyone. And then we also are going to be sharing some resources today. And so just so you know, we'll be doing a follow-up with links. And then anything that you all are sharing, we'll want to be able to get those links as well so we can share them with everyone. So we just ask that folks, please mute unless you're speaking. And then you can also feel free to use the chat or raise your hand if you would like to unmute and ask a question or add something to the conversation. Mo, do we have the captioning turned on for this?
Yes, I do. So you should be able to go to the bottom and click on captions, and then you can look at the captions. Also, if you go and want to view the entire transcript, you can click on that and it'll kind of open up in the side like the chat is.
Thanks, Mo. So as I said, Mo and I are your hosts. So we'll just do quick introductions, and then we're going to have, some of you are introducing yourself in the chat, which is great. We're going to have an opportunity for you to add a little bit to that if you would like. But first, we'll introduce ourselves. So I think I know probably most, if not all of you. I'm Jen Grove. I'm the Prevention Director here at the National Sexual Violence Resource Center. This picture is a lovely picture of our city where our office is located, which is in Harrisburg, Pennsylvania. And that is where I also live. And I have been with NSVRC for 18 years now. And this month marks my 25th year in the movement to end sexual violence and intimate partner violence. And so really, tired. I guess is what I would want to say right now. Tired, but also energized when I'm in communities like, this space with you all today. So I look forward to, to talking with you all and hearing from you all. Mo, would you like to introduce yourself?
Yeah, hi everybody. I'm Mo. I'm the prevention specialist at NSVRC. And I really love evaluation. I'm always really happy to be here and get to talk about evaluation with folks. Hopefully it will be a fun time. I live in Tacoma, Washington, so I work remotely, and I have for the whole time I've worked here at NSVRC.
Thanks, Mo. So we are wanting to do some introductions. So first of all, do we have anyone new on the call? And if you are new, feel free to, you can unmute yourself and say hello and introduce yourself, or you can put your information in the chat. But if you're new, we're going to give a pause here for anyone who might want to introduce themselves.
I'm not new, but this is my first time on one of these calls. My name is Jessica Miablos. I'm with the Louisiana Foundation Against Sexual Assault. So I'm with the state coalition. We don't currently have an evaluator. So Jen and Mo kindly allowed me to sit in for this.
Hi, I put my info in the chat too. My name is Olivia Little. I'm new to this. I haven't been to one of these meetings before, and I'm newer on the project. I'm at the University of Wisconsin Population Health Institute, and we're involved in the state evaluation of the rape prevention education program.
Jen, we can't hear you.
Sorry about that. Thank you. Too many buttons on my computer. So thank you. It's welcome to everyone who's new. And also those of you who are back for more. So if those of you who've been introducing yourself in the chat, here's some additional questions that you can let us know if you would like in the chat. Anything you want us to know about you, where you work or live, your pronouns, how you're feeling, or maybe what you need today. And also thinking about spring, we have cherry blossoms that are starting to open in yesterday was February. I went for a walk here in Harrisburg, Pennsylvania. We have cherry blossoms opening. So that's fun. I love springtime, but I'm also fearful that we're going to get a huge snowstorm. And so, yeah, thinking about spring. So favorite springtime activity. So feel free to add that in the chat. I see Emma has replied and from California and evaluating the RP program there. Great, welcome Emma. Also Julia, feeling pretty good today. That's awesome. And your favorite springtime activity is just getting out and going for walks. And seeing the life return to the earth. I have to say it was nice to see, although I was a little scared, it was nice to see the cherry blossoms yesterday on my daily walk. So I hear that. Welcome Roxana with New Jersey. And Chloe's saying, oh, so jealous here in Utah. It's only been snow for the longest time. I feel like even our folks in parts of California are getting more snow than we have seen this year. We've had very trace amounts of snow here in Pennsylvania. Hey, Patty. Patty is, let's see, working with Kentucky, Missouri, of course, living in Las Vegas where it snowed this morning. Oh my gosh. I feel like the weather has just flipped. Like, people in New York City yesterday were so excited and it was like maybe an inch or two, I think, on the ground, but that's all they've seen this year. So something's definitely wonky in the air. Climate change for sure. Aggie says, I'm training for a half marathon with some friends, which has been a very fun pre-spring and springtime adventure. Well, that's great. Oh my gosh, good for you. Half marathon. You go. Jesse is saying favorite spring activity, camping. Oh, that's awesome. You have an overnight in Tennessee this weekend and then Catalina Island. Oh my gosh, on the California coast, a multi-day hike. Oh, that sounds lovely. And Jennifer, hey Jennifer, making soup helps warmer up in the snow. I get that I'm always down for some soup in the cold weather. And Sandra is saying her springtime activity is going for walks and seeing flowers starting to bloom. Yes. Cheryl is wishing they'd gotten some real snow this winter. Spring is lovely. So yeah, Delaware, you're feeling it too. We're very close to Delaware here in southern Pennsylvania. Got Jesse. We got the camping. Okay, sorry, I'm going backwards here. Catalina, we covered that one. It's beautiful in Texas today. Oh yes, so can't decide if it's spring or winter. I have family that lives in Houston, and I feel like they've gotten more cold weather than we've gotten this year. Awesome. So we have folks from Iowa. Spring activity is garden dreaming and planting. Oh yes. I know a lot of people are planning for their gardens. And Mina in California, you got snow in Sacramento, maybe hail. It was cold, whatever it was. Carrie, let's see. Yeah. Legislation in Iowa around social emotional learning, LGBTQ plus inclusivity, but yes, hearing that in a lot of different areas, even local politics. Happy to see the sun early in the morning. And Olivia, looking forward to warm weather and camping. So, all right, well, thank you. Feel free to keep adding in there. This is really great to hear what everybody's doing and looking forward to. Yeah, it's definitely, I love to see the new things growing as we go through the seasons. So, all right, Mo.
Okay, I am going to tell us the agenda of what we're gonna do, and then also lead us in a grounding exercise. And I actually have, there's something in my teeth. Okay, I have a grounding exercise and I have a breathing technique that I wanted to share. But I know that also people don't always love a breathing technique. And also all of these are opt-in. You don't have to do them. You could go get some tea or coffee or something. And then actually, I'm gonna hide the captions because it's hiding what I can see. We're gonna go through some NSBRC health equity resources. We have a whole bunch of resources that I feel like you might know about and you might not know about. So we're just gonna go through some of the things that we have available. And then we'll also have time for group sharing. And I'm thinking that's gonna probably be at least half of our time, if not the vast majority of our time. So that is the agenda for today. Yay. Okay. So what I'm going to do first is teach you this breathing technique, and then we can try it. We can try it 3 times. And this is opt-in because I know that sometimes doing any sort of like deep breathing or intentional breathing is actually like the opposite of relaxing for people. So if that is true for you, then you could like listen to me talk, or you could like go take a break, or you could just look at this photo. But for folks who are interested in things like that, there is this technique that I learned that's called the physiological sigh. And I'm guessing that you probably know about it already, or that you've heard about it. And it is a way of helping like reset your nervous system, or helping you shift from one kind of gear into another gear. And it's funny to me because when I learned about it, I was like, oh, this is like totally how I cry, or how like I cried when I was a little kid. You know how when you're a kid and you're like like that, you're like and something about that intaking of the breath is part of that physiological sigh. So I'll tell you the way it works, and then we'll try it, and we can do it 3 times. The way that you do it is you breathe in through your nose, pretty much like a full breath. And then once you're like pretty much done with breathing in, you go, you sniff in and just breathe in a little bit extra. And then what you do is go, and you sigh it all out. So I will demonstrate for you. I feel kind of wacky doing this, but also I really like when other people do it. So I'm like, I'll just do it and we can just be wacky together. So I'll demonstrate it, and then we can do it together 3 times. And like I said, please don't feel obligated to do this. And if you do it and it stresses you out, then take good care, because I will be doing a grounding exercise after that. And it's very, very short and sweet. So watch me do it and listen to me. Okay, that felt weird, but I liked it. So what you do is you breathe in almost a full breath. At the very end, you could just go, you sniff in a little bit extra, and then you breathe out through your mouth. So let's do it 1 time together. Do it 1 second time. And then if you're still following along, let's do it just 1 last time. Okay. That, or feel it and like see how it makes you feel. I have done this a lot when I'm like trying to transition from one thing to another, or if like something really works me up and I'm like, then I'm like, okay. And then I just like do the physiological sigh. I don't actually know how to spell it. I don't know. Jen and I are both typing. So Jen said that you've had a bad head cold that cleared your head. I typed in physiological sigh. You should look it up. It's really interesting. If you didn't like that, if it made you feel weird, if it didn't work for you, I want to try another grounding thing. And I'm going to move through this just pretty quick because this is a thing that you can do anytime, anywhere. And it's the 5, 4, 3, 2, 1. And you probably already know about it, but we could just do it now. So the task is, and I'm going to switch it up a little bit because we're on Zoom. So first, notice 5 things that you can see. We'll just take a second to do that. So just do it real quick. Look around. What are the 5 things you see? You can just name it in your head. Okay, now do 4 things that you can touch. And it could be like your clothes or like the feel of your foot in your sock or shoe or barefoot. It could be like the desk. So just 4 things that you can touch. Now do 3 things that you can hear. So probably one thing is me talking, but what are 2 other things that you are noticing? 3 things that you can hear. For me, it's a fan that's in this room. Well, not a fan, it's a little mini heater, and also the birds outside. And then do 2 things that you can smell. It might be just the smell of the air. It might be, I don't know, you put dry shampoo in and you can smell that, or like a perfume or your deodorant or like whatever food you have or a coffee or something. And then 1 thing you can taste. So maybe it's just like literally whatever you have just eaten is what you are tasting, your toothpaste or like the tea or coffee or something. I like to do this anytime. For me, I move through it really quick because the purpose of this grounding technique is just to like literally bring you back into like, hey, we're in a physical space. You have senses, your senses are sensing things. And I think, at least for me, a lot of times I will forget that that I have all those senses, and I'll get like really wrapped up in my head, especially around life stuff and around work stuff. And so the thing I like about both of these is that you don't need to like tell anybody that you're doing it. You don't need to be like, oh, I need to go away for a moment and do this special thing. You can literally do it anywhere you're at any time, and no one has to really know that you're doing it. So those are the things that I wanted to offer you. And I want to say thanks to Sally. I know she's not here, but thanks, Sally, for recommending this. It's pretty fun. Yeah. Okay.
Thanks.
Now we can move on.
Thank you, Mo. No, that's
Thank
good.
you.
I saw that Sally was definitely saying like, hey, like folks have been asking for this. And so we hear you, and we love that she put it in the agenda. Sally is so organized. She's gonna listen to this later and hear me talking about her, but this is all good. You know, Mo and I were able to just look at a agenda that she put together. We put together some slides and communicated about what we wanted to talk about with you all and what we wanted you all to be sharing. And so it's been an easy process to hop into this, but we do miss Sally terribly. Yeah, that was definitely helpful. And Mo, are we showing up as the same person again in the chat?
Yeah.
Am I showing up as you, or are you showing up as me?
I don't know. It just says
Okay.
you.
Okay. So
So
yeah,
I don't know.
I don't know. This happened to us like last week. So
We can just deal with it.
I'll try not to respond in the chat. I'm going to let that up to you, Mo, if you don't mind. That way.
Patrick said we're both Mo in the chat. That's okay. We're logged on to the same Zoom. So
Okay.
I think
We'll
it'll
figure it out.
happen.
But okay. Well, yeah. So what we thought we would do is based on kind of like past conversation about health equity and the real like push for health equity approach in prevention, in RPE, evaluating RPE. We thought it would be good to do an overview for you about the things that we here at NSVRC have put together around health equity. So you're aware of those. Some of you, this might be a repeat for you, but we wanted to just highlight some of the resources that we have available. And then, as Mo had said, like you'll have an opportunity then to, I think Sally there was supposed to be a reminder going out, like if you have tools that you're using or resources, we would love to hear about them. So then it will be your turn to share what you're using and what's working for you. So the first thing that we wanted to talk about was, I think this is the thing that we hear is being used the most. And we hope that this is true for this group. We have a fantastic guide that we put together in 2021 with Prevention Institute. And it's called a health equity approach to preventing sexual violence. This guide, I think, is really important because it highlights programs who are doing health equity work in their sexual violence prevention. And it talks about the connection and the why. We also did I think there are, oh gosh, I probably should know this. There's definitely a good handful of programs that are highlighted in this book. And At the time that we did this, I believe they were all receiving some part of like rape prevention education funds that were helping to promote these and support these activities that they were doing around health equity and sexual violence prevention. In addition, we did a webinar with Prevent Connect and Prevention Institute on just an overview of the guide. And then what we did was we have some folks on the webinar from some of these programs that are featured in the guide that talk about what they're doing for health equity work, how it fits in with their violence prevention work. And it's just a nice opportunity to kind of highlight those programs in the guide and hear from those programs directly. So that is one resource. Again, this is the one I hear people referring to the most. It's something that and thanks for the link, Mo. It's something that we will probably look at continuing to add to or update as we are moving forward with health equity and making sure that it's something that we're focusing on with our RPE work. And if you have any questions or thoughts about any of this, feel free to pop it in the chat or raise your hand or anything like that. We also, around the same time we were putting that previous guide together, we got a COVID supplement grant for the Resource Center. We were able to kind of really sit down and think about what can we do with some of this money to get resources out there, to also collaborate and work with some of our key partners on the topic of health equity. And so we were thrilled to be able to we have a partnership with the National Resource Center on Domestic Violence. We go back many years as the two national resource centers on both sexual violence and domestic violence. We are also located in the same city because we were founded by the Domestic Violence Coalition in Pennsylvania and the Rape Coalition in Pennsylvania. So that's a little fun fact, a little historical fact for you. So we go back quite a ways with our partnership, but we were able to really sit down and think through, like, what can we do to create a resource that's looking at capturing the information and the stories and experiences of survivors and communities in figuring out how to promote health equity, at the same time, like looking at those intersections of sexual and domestic violence, intimate partner violence. And so what this resource did was really, and also we had significant input on this guide from and leadership from Black and women of color survivors and advocates. The resource really is looking at how do we make connections between health equity and our work to prevent both sexual and intimate partner violence. It centers the stories of survivors who are at the intersections of systemic racism, violence, oppression, and also explores ways that we can build both individual and organizational capacity to address health inequity. And it offers a call to action for people who are in organizations who are ready to commit to health equity in their gender-based violence prevention work. Excuse me, still dealing a little bit with this cold that I've had. And so the guide itself is fantastic. Again, really utilizing input and review and the lived experiences of Black and women of color survivors for this piece as well. And then we were able to promote this guide, we did a web conference with Prevent Connect and with our partners at NRCDV. And the web conference was about the resource. And we also had these presenters sharing how to center Black survivors in the fight for health equity and violence prevention. And it was a really powerful, powerful web conference. The recording is great, not exactly the same experience when you're like right there with the presenters and having the chat discussions, and it was really, really powerful. And so highly recommend this resource as well. And then Mo, you're going to talk a little bit about some of our podcasts that we've done that have promoted health equity. And
Yeah, I have to say, I was really like, wow, we've got a lot of stuff. So I don't know how much detail I should go into with these. I'll share the links to them as I'm talking about them. So this first one is Anti-Blackness in the Movement podcast series. And we were able to partner with Darren Dorsey, who previously worked at, well, he's worked with actually like a couple state coalitions, and he used to work at a local program doing sexual violence prevention work. And this topic is just really big, and also like, we're not the people to like do this podcast series, right? So we partnered with Darren, and he reached out to folks that he knows and has worked with, and some names here that you probably recognize, to talk with folks about anti-Blackness in the movement, both like what people's experiences have been personally, but also like what are the issues within our systems? How does anti-Blackness show up in the institutions, in the systems, in the workplaces? And they talked a lot too in the podcast series about what are things that people need to do to change. So not just like individually, but also specifically leaders within organizations. So that is one set of podcast series. When you go to the link that's in here, what you'll find, I wanted to point this out, is you'll find a blog post by Darren. So he did the first part of the blog post before the podcast series happened. Then he did a follow-up blog post that's underneath the recordings. And then the other thing that we did as an organization is we asked the management and leadership team here to really use this as an opportunity to do some learning and show our own accountability, or be accountable, and not just be like, oh, hey, here's a cool thing that we made, but also be like, we are also listening to this, and we are also taking lessons from this. And so there's a management team response here as well, where they go into detailing what we learned and then the action steps for moving forward. There's also a really good list of additional resources too. So you'll see once you go to that link, it has all the stuff, including the links to the podcasts, of course. So then this one is a series we did, it feels like forever ago, to be honest. But the blog post I'm seeing is from March 24th, 2021. Sexual violence look like in a pandemic, and how have people been adapting their work? This is the COVID-19 and health equity podcast series. If you go to this link that I just posted, you'll see like a really nice overview of all of the things that we did in the podcast series. And it was basically like different staff from NSVRC interviewing folks, or just talking with folks about how they have adapted their work, specifically around the pandemic, and then also around health equity. The other thing that I really like about this is that in the first episode and the last episode, you can hear me and Yolanda, who's our ED, and Louie, who is another person who's not really in the prevention staff, but he is like, I don't know, I feel like he's our prevention pal. He's on a different team. So 3 different folks from NSVRC. We're talking initially about like, what are the things that we're seeing and what are we looking forward to? And then we follow up at the end about like, what are the lessons that we've learned, what touched our hearts, and how our perspectives have shifted. So I really like this. It has some really good, things in it that you could literally pull out and be like, oh, we could try this in our work, or like, oh, this will shift my perspective about how we can pivot and meet people's needs during this still ongoing pandemic, and yet still have it meet the needs of our work and prevention. So yeah, that's another one. And then this one, Jen, I don't know where this link is. I'm gonna look it up right now. Data equity, make sure we all count. So
it's a podcast. So it would be
I'm gonna find it. Here it is. I found it so quick. I just did a little searching. I feel like that's my skill. I can do a little searching. So this is a really nice podcast. We have a series of podcasts. I mean, we are always doing podcasts. It's called Resource on the Go. We don't have a ton that are specifically focused on evaluation, but this one does. And Sally talked with Heather Kraus, who's the founder of We All Count. And they talked a lot about how data equity can like maybe be done better, or maybe be we can be more thoughtful about the data that we're gathering and how we're gathering it and how we're using it, and the opportunities that we have to increase health equity, like through the way that we do our data collection and stuff. So yeah, I highly recommend that. These are so many links for you. Maybe what we can do is collect them and send them out. But you know what we could do is we can put them in the source, and then you will get an email about it, but then you can also access it there.
Yeah, we'll definitely make sure to get the links to you. Thanks for talking about our awesome podcasts, Mo, that support the work, the health equity work. We also did this language, and back in 2021, actually this went into, I think this went through 2022. There's a language and health equity blog series. Sorry, I get my blogs and podcasts all mixed up. I'm always calling blogs podcasts, podcasts blogs, even though I read and listen to both. But this was on looking at sort of language and health equity, and looking at access and justice issues in the field. And so the blog series featured 3 blogs, both in English and Spanish. We wanted to really find out how people working to prevent sexual violence and working toward health equity, we're doing that by increasing language access and justice. We collaborated with some leaders in the field to create this blog series, and it really lifts up those lessons and examples of increasing language access, and how that links to health equity, and how that helps us in our sexual violence prevention work, and just creates access points for multiple people when we're really thinking about language access. And so we had 3 folks who helped us out with that, really reflecting on their journey towards language access and justice. They touched on health disparities and lessons they've learned, and then really offering some tips for other people who are in the field. And so I definitely would recommend that you check that out as well. And looks like Mo has posted that link. And then last but not least, we wanted to mention these opportunities that we've been doing since COVID. We have been doing these RPE virtual connection opportunities. These are open. We have been doing them in mostly June. I think one year we did them in May. I've only been doing them 3 years, so I don't know why I'm acting like it just feels like a long time since COVID. But we offer these opportunities to really get people connected in that time in 2020 when we were supposed to be meeting in person, and we had to cancel all of those things, and we wanted to still bring people back together. So we started just having these connection points for RPE directors at state health departments, RPE evaluators, and also the coalition, the State Sexual Violence Coalition partners, giving space for those connections to happen and for conversation to happen and for learning and sharing. And so last year, I think what we learned, last year is that we hit a really high note with some of the presentations. So what we did was we ended up doing 5 mini presentations for each of the virtual connection opportunities. We then had time for folks to choose a breakout room based on which presentation they most wanted to dig into more, talk to the presenter more about. And so some of the things that we worked with Prevent Connect and with CDC to plan these, and really honing in on health equity and anti-oppression and all the things that are kind of hot issues. And so we had some really good presentations. We have them saved and accessible on our YouTube channel, but you have to have a link to get to it. So we'll make sure to get you these links if you haven't seen them already. There was a presentation around some work that Ohio has been doing around addressing barriers to their prevention programmings because of the pushback against critical race theory. And like, how do you talk about what critical race theory is, or why this is an issue, why talking about anti-oppression is an issue, why talking about LGBTQ student issues is an issue in some communities, and really like thinking through how to deal with that pushback that a lot of communities are getting, have been getting, and even now entire states are pushing back on. So we had a wonderful presentation by Indiana, by Sierra in Indiana about their disability justice project. And we had folks from Iowa talking about economic justice work that they're doing in the state and what that looks like. And then we also had our friends in Colorado talking about some work they've done to really prioritize equity in all of their sexual violence prevention programming, and kind of what the process was to go through that and how that's shaping up in there. So anyway, those are some things that we have available. Yeah, Gwen says Sierra is amazing. Sierra is absolutely amazing, and probably like one of my most favorite people ever to work with. And I work with a lot of great people, but there's just like something about Sierra, who talks a lot about their disability justice project. Always happy to work with her and lots of people who are doing this amazing work. And so this is just one piece of what we can do in capturing some of the great knowledge that's out there, and the information that's being shared, and the resources that other people are developing. So we hope this was helpful. Again, we'll make sure that you get access to these. Oh, thanks, Mina. Yeah, it was really great. The session on disability justice was really great. So we'll make sure that you have access to this. We do want to these links. We do want to now offer you all time for sharing. And I believe you're all supposed to get a reminder email to bring your sort of a show and tell, like, what are you using? What's been helpful for you as you center health equity in your evaluation work? So we're going to just go ahead and open it up for that now. I'm going to mute myself.
Hi, I just noting that you all had a resource from We All Count. I know our team did a training with them, and I thought that they had a lot of interesting and kind of useful tools there. So throw that out there for what it's worth.
Thank you, Olivia, for sharing. Yeah, I know that was a really good question, or a really good conversation that Sally was able to have on that podcast. So yeah, for anyone who doesn't know about them or wants to listen to that, it's a really good conversation. I know I did not know about them, so I learned a lot about We All Count just listening to that.
I see a question from Lillian. It's not related to equity, but a question about the upcoming conference this year. And I will say, we welcome your questions. So you can type it in the chat if you want, or you can unmute yourself. Either way will work for us.
The process for attending and expectations. Yeah, I don't know. I'm trying to think. So we put out information to RP folks in the fall that NSVRC would be paying for one RPE director, one coalition representative, and one evaluator from each state and territory to attend the RPE National Dialogue, which is the day before the conference starts. So it's August 21st from 1 to 4. And then the conference starts on the 22nd and runs to the 24th. And so we're basically able to cover for those 3 people from each state. We're able to cover travel, pretty much everything except for your registration to the conference. There is no registration fee for the RPE National Dialogue. We'll have more information coming out about that soon with a lot more detail. We're working closely with Valor out in California, who are the conference hosts, to put together all of that information so that when they release the information, I think they're releasing some information in April, and then I believe registration opens in May. It should be a seamless process to be able to register for both. And then we'll be in contact with people who are registering to follow up about all the details regarding what NSVRC is covering. I don't know if that's helpful or not. I know there will be a prevention track, which is what we recommend all the RP folks, like, hey, like, if you're going, register for those, and we'll make sure to have those designated for you of like which ones are the RPE prevention track.
Can I add something, Jen?
Yeah,
That might be a consideration for folks is, I'm not sure about the answer to this. If it is like, if there are expectations that people will attend, because I know that with the way that the COVID safety is being planned there, it might be a conference that's not accessible for some people. And so I don't know if there is an expectation that people have to go.
My understanding
from,
it is a
both in their health departments or anything.
Yeah, my understanding of this is our meetings are typically just optional. Anything NSVRC puts together is optional. It's recommended, but optional. I know there was a travel letter that went out to RPE directors from CDC so they could get approval to attend the conference. But typically it's recommended, but not mandatory. When the CDC starts having their recipient meetings again, I think those are the ones that are mandatory, but I really don't know. That would be a question for CDC project officers about that, but yeah, it's from what we know and from past experience, the conferences and the meeting is a recommended activity for folks to participate. But yes, as Mo said, we know that not everyone is going to be comfortable participating due to COVID and due to sort of large group gatherings, and also maybe just not being ready to travel at this point. Marissa, you added that the resource from NSVRC on risk and protective factors has been really helpful for RPE evaluation and planning as it relates. Oh my gosh, I'm so glad you said that. I see Mo has had to step away from their computer for a second. So, but yeah, we love our risk and protective factor infographic. Thanks for putting that link on there. We also have an interactive I think we call it our interactive infographic, risk and protective factor infographic, where it's a sort of an animated version of the infographic. We'll make sure to add those to the list, but we think that the risk and protective factor infographic is fantastic. Mo and Louie, who she mentioned before, who is one of our training coordinators here, on another team, they've done some really great trainings on the risk and protective factor and really utilizing it to help communities sort of wrap their minds around, like, how do we make the connections with, how do I talk to my organization, my director, my coworkers, my board, my other funders, like, how do I talk to my community members about why it's so important to do in our sexual violence prevention work, to be doing anti-oppression work, to be looking at inequities and how to work towards economic justice, disability justice, like whatever it might be. They're really like helping people figure out how to have those conversations. And I know Mo can talk a lot more about that, but I I feel like that risk and protective factor infographic can be used for a lot of good things, good supports. Okay, and Sandra said, yes, really like that one, and the one that crosswalks the social determinants of health. Yeah, and use them a lot. Awesome. I don't know what you mean by weights for the risk control. What do you mean? Can you talk about that, Yasmin?
Sorry. Yes. So we're trying to develop a gender-based violence index to prioritize some of our areas. And while we're using many indicators, what we initially had done was take our risk and protective factors and identified indicators that were useful for each, that would measure each of the categories of risk factors. So for example, we know alcohol is associated with 50% of all rapes, right? All sexual assaults. We know that ACEs, that 30% of males who were exposed to ACEs as children will perpetrate rapes. And so between those two, if we take the association, 80% of all rapes can be predicted with the use of alcohol and ACEs. Now, our gender-based index is using 4 domains. We're using demographic data because we know, for example, that LGBTQI communities are at higher risk. We know that disabled females are at much higher risk. And we know that Black women and Native American women are at very, very high risk as well. Not to say that nobody else is, but we're going to use those demographic factors. And we also know from the literature that the male to female ratio predicts both IPV and rape. So those are our demographic factors. And then we looked at gender inequality because gender inequality is a big risk factor or a societal norm in terms of as being a risk factor for sexual assault. So we looked at things like a woman's median age, so the proportion of, the median age of women over median age of men. We're looking at housing of women, and we're looking at the neighborhood. And by neighborhood, we mean what's the median value for the house in the neighborhood that's woman-owned. And then we looked at, as a poverty measure, we looked at female-headed households because female-headed households tend to be much poorer than everybody else. So rather than have a direct poverty measure, we looked at female-headed households. So those were the inequality indicators. And then our social indicators, we had alcohol, from our BRIF survey, alcohol, ACEs, a whole bunch of others that I can't recall now. And then in our societal domain, policy and laws, we looked at the number of rapes as a proportion of the number of convictions. So number of rapes reported as a proportion of number of convictions as a proxy sort of measure for weak laws. And then, a couple of other things, and juvenile arrests and so forth and so on. Juvenile arrests for rape as a proportion of all violent crimes by juveniles. So things like that. Now, in order to make the composite index, we are trying to figure out if anybody has weights for all of those, so we can weight the index. I mean, we'll go with weighting them all the same. But we're trying to do that so we can prioritize which of our areas are unsafe for women and will predict sexual assault. So that's what we're trying to do. But
Thank you
that's
for,
where I'm at.
yeah. No, thank
Sorry,
you for
that was a long
sharing.
answer.
No, that's good. No, yeah, we definitely don't have weights in the resource that we have. I see that Gwen has a follow-up question for you though, asking, are you using logistical regression to do this, Yasmin, or what kind of analysis are these numbers coming from?
So we're not doing, we could do logistics, but what we did was we took, you know, because some of the sample sizes are really small. We're going to look at each county in the in New York State. So we're not using logistics. What we are using are z-scores. And then we'll probably use when we come to the funding methodology, where we rank the counties.
Thank you for sharing that. Hopefully that answered your question, Gwen. I do want to go back. Lillian said you have a success and challenge you want to share about the work you're putting in to complement quantitative work using quantitative work using qualitative information to amplify youth voice in legislative work. Do you want to talk a little more about that?
Yeah, I can talk briefly. I think I just thought, I think at the beginning when you're talking about the work in Ohio, and we learned a lot of things, I think, from some of the interactions and discussions. But last year, so that was my first full year working as sexual violence prevention evaluator, and part of my work, or the biggest work we were doing, is to really try to strengthen. You mentioned like some of the challenges and pushback from the community. So we really put in effort to amplify like the stakeholder, like the grantees and the students' voice, especially into the data. So we created a survey that we had tried in 2021, but we improved on it last year. And we also had some focus group to have like youth speak to some of the experiences in addition to the Healthy Kids Colorado survey, which we normally get. So this was not like part of the official, because officially they just do the Healthy Kids Colorado and get that. But the limitation with that, when you get pushback, and the questions have also been changed or modified for a few times. So sometimes people will be like, oh, but youth can't say this, or I don't think the youth answered this way. So like when you have the numbers and you try to say this is what the youth are saying. So what happened is this year, I mean, I just came back and I was reviewing the report because I was on leave, but I left after I had the data in place and all of that fun stuff. And my colleagues helped me with it. I was looking at the website, they haven't put the current one yet. So when I find it, I'll share, hopefully at some point next year. I mean, soon, or if you remind me, I'll keep looking out and share if you tell me where to put it. But yeah, so we got some pushback about the discussion like, oh, youth were not saying it. But then when they were looking at the data, now we were able to get a much more healthy discussion with even some of the state, you know, the top officers who are always saying, no, we can't share this with the public. So anyway, they had like this interesting discussion where, so the success was having this data necessitated conversation around the outcomes. But then the most interesting part, we realized that even with quantitative data, we needed to think about how we were using that information, especially given where the questions had changed, because now the new question was, hey, but this question changed, it wasn't there. So how sure are we that blah, blah, blah. So just like that, the conversation is the success and the challenge is the lessons that we hope to get from there to improve the work. Thank you for listening. I spoke too long.
Thank you so much. No. This is all your time to share. So like, this is really great to hear. I love that the way you said it, you know, your efforts to amplify grantee and student voices, like in the data, that's so powerful. I mean, wow. Thank you for that work. Sorry.
This is Aisha from Texas A&M. I wanted to weigh into what Yasmin said earlier.
Well, Aisha, sorry,
Yeah.
we can't hear you very well. It's it's breaking up. Oh wait, it might be better now. Hold on. It's breaking up a little bit.
Okay, I'm in my car, that's why.
Yeah. Okay.
Is it better now?
Yes, that sounds better.
Okay, so I was saying I wanted to weigh in on what Yasmin said. We didn't do a quantitative look at the data. What we did was a scoping review to come up with a disproportionalities report to see what's happening in the state of Texas and nationally. And the results of our studies are given us answers that are very similar to what Yasmin's team did that is quantitative. So I was just thinking that kind of ties up things and it's making it look, the problems are quite similar, even though there's some variation, different states and different counties, but we're seeing the same kind of a trend. We're seeing higher rates in African Americans, higher rates among unemployed, higher rates among Native Americans, so, and figures like that. So I just wanted to say, like, okay, this is kind of tying up things. Thank you.
Could you share that with us, if you don't mind?
Yes and no. We have completed the report and are just submitting it to CDC. Once we get it finally approved, then we can share that report with everybody else. We could ask the team and they can let us know which website to just post it on. So at the moment, in the next 1 month, it might not be ready for sharing, but by the end of March, I think it should be good to go to the public.
I'm more curious about your methodology. Can you share that?
Oh, okay. Our methodology, what we did was a scoping review, kind of similar to a systematic review. We were looking at all the available literature that, and then and what we did was that we identified themes in the literature, and then we picked up, for each one we looked at the studies we did a really rigorous systematic, I don't want to call it systematic, but we did a really rigorous review of available literature.
Okay. So would you be able to share that literature with us at least?
Yeah, I think we can. I think we can. I'm sure by the end of the month, the whole document will be ready. So we'll be able to share the whole document with all our references. But if they let me know where we can put up the list of references, we can share that with you if you want to look at it too.
Oh yes, please.
Okay.
I would appreciate that very much.
Okay.
Could you share it through the resource center?
Okay, yeah, I think that's doable.
Yeah. Thank you so much.
You're welcome. Okay.
Thank you so much.
Thank you, Ayashatu. That was wonderful to hear, and love that y'all are sharing, being able to share some things amongst one another and each other. And we can absolutely help get it out to folks through our channels as things become available. And Mo, while you were gone, folks were talking a little bit about how useful they found the risk and protective factor infographic to be in their health equity work.
That's so nice.
Yeah, and I was talking about the interactive one that we have, but I don't know if you want to say anything about that. I mentioned briefly about the trainings that you and Louie have done to really help, using that to help people connect the dots.
Yeah.
So I don't know if you have
talk
anything you want to
that.
say.
If people are interested, if you need a training, we do trainings for free. They're funded through our own RPE work. And I feel like Louie and I would both be happy to do a training like this. We've done this, I want to say 4 times now, a couple of conferences virtually, and also a staff meeting of ours and a meeting for somebody else. And we call it, what do we call it? Rediscovering our interconnectedness. And it's basically, I'll just tell you this, it's basically our way of saying, look, we can use this public health framework approach to justify doing the work that we know is important and the work that we know that our communities want to do. And so when people say, oh, Black Lives Matter doesn't fit into prevention, we can actually use risk and protective factors and social determinants of health to tie back a string or a thread to say, yeah, it actually does count. Prison abolition counts. Housing justice counts. Anything that you can kind of imagine. I would say also, you know, for better or for worse, but things that you want to do in your community, we can really use those public health frameworks to explain to the powers that be why this actually does count toward sexual violence prevention. So that's a thing that if you know people who are like, I don't get it, I don't understand why you would want to do this, it doesn't make sense to me, I don't think it's real prevention, then keep us in mind. We could do it webinar style. And it's fun because it's interactive. So we'll be like, you tell us what you want to do, and then we'll like help you trace it through the infographic. Oh, and then Mina just posted that you developed this infographic to use to explain the connection between sexual violence and economic security. That's very cool. I'm gonna.
Oh my gosh, that's so exciting.
Yeah, I'm really into this. Sometimes we need different things to understand something, right? Like, some people are
Yes.
very visual, some people are very auditory learners. Oh yeah, this is really
And wait,
cool.
someone is here from Delaware too. And like, I love the paper that Delaware did on economic security as well. The resource, it's amazing. There's so much good stuff out there that I feel like we kind of sometimes find out about just in conversation. So yeah, if you've got stuff, please share it. Gonna make a note of that. Oh, it's a long, it is a long website link, but you know, I think we're used to that. Here, sometimes our links get a little lengthy. What else are people using, or where maybe there's some gap, like where some gaps existing where, you know, information is needed? That could be opening up a whole can of worms.
You know, much of our data is actually, except for the SV rates, the census data has some very, very good information. I mean, and the Bureau of Labor Statistics, you know, you can pretty much do it at a very local level. I mean, it can go down to zip code, not even zip code, but census tract information, right? And the census data is probably among the most data, it has good data quality. So for many of our indicators, except the SV, you know, but we have the BRIF survey, which has a sexual violence module, and, you know, we can use that, you know, to estimate rather than use reported rapes from UCR. You know, so this year, New York State just paid for those two questions, trying to find the incidence and prevalence of rape and then other sexual assault. So we separated that out. So, you know, the data on norms is what I'm trying to find, you know, because sexual norms is, after all, the biggest. It is our long-term indicator, right? That's our mission, really. You know, and so that data is hard to find. And I'm wondering, you know, if all of us can get together and find some money and do this nationally, but by state. You know? So.
Yeah, this is Aisha again. I absolutely agree with you. When we were doing the literature review, we really didn't find much. In fact, I think we didn't find any peer-reviewed document to about the norms. So it would be good if somebody can collect the data.
So what's your think? Can our resource center tell us how much it would cost to do something like that? And we find the money?
Yeah, I would not know the answer to that. How much it would cost? It's a great question. I don't know who the person or people would be to ask. Maybe the CDC, but I don't know.
You know what I found amazing though? As I was doing the literature searches is about how lacking the data is. Like people will look at just one age group, like college age, but very little at school. You know, it's like, it's in all over the place. You know, there's no coherent theme in all the research that they're doing. And it's like, what? This is the oldest disease of all since time started, you know, and we don't have cohesion in our literature. So that was shocking to me.
Yeah.
Okay, I don't say much on these things, but as a sociologist, I really have to ask if you all are looking at data. You may be looking at public health data, but no, they don't do that. We do in sociology, we do in psychology and social psychology. And yes, it may be stratified by age and other things. But NORC, which is one of the resources in some of the materials that you all have sent out, NORC has been asking questions of this kind on these kinds of things since I can remember, and I've been at this nearly 50 years. So and one of my favorite phrases at CDC was there is intelligent life beyond Medline now, PubMed. So don't restrict yourselves to the health literature. You really got to go out further. Criminology, we've been doing a lot of this stuff for years.
Yes.
And that's why I said to you, you need to talk, if you want to talk about weights and you're using DOJ data, talk to the Office of the Bureau of Justice Statistics. Every one of their publications has details on their weighting.
Who is this?
So,
Which you broke up there for a second? The Department of
it's
Justice?
Potter. Yeah, at the Bureau of Justice Statistics and the Office of Justice Programs at the Department of Justice. Yes.
Okay, thank you. Yeah, I saw
Yeah.
that and I didn't know, you know, I couldn't reply to it. So I'll make sure I do contact them because I've seen the criminology data that has that kind of, you know, for perpetrators especially.
Yeah, and just as our colleague from Idaho was talking about, we've gotten much better at state levels over the years. Again, I was a planner evaluator back in 1982 at the state of Florida. I won't talk about how backwards we've gone now, but you know, so you probably have somebody there in New Jersey. I'm trying to remember who I worked with on the old HIV reentry project from, I mean, they're all retired by now, but you know, you've got somebody at whatever agency in your state collects these data who can probably tell you about their weightings. And certainly I know on the National Crime Victims Survey, 2 of our former students from sociology here work on the victimization data for Bureau of Justice Statistics. So I'm sorry, folks, I get frustrated occasionally because I went to public health in '98 and got told things weren't being done that had been done for 20 years. So sometimes you have to look outside your comfort area and really, you know, I mean, when we talk about intersections as opposed to intersectionality, you know, we've been doing this stuff, particularly in social sciences. I started in '71, so, you know, look elsewhere.
Thank you for that. Would you mind if we kind of reached out to you after to get some more directions? Because yeah, well, listening to you now, I'm realizing we probably didn't look that wide enough. That's why we're thinking it's not there. Thank you.
Sure, I'm happy, rhpotter@ucf.edu. I'm real easy to find.
Thank you, RH. That's good to point out. I know we subscribe to all those journals here, and I feel the same way, like always concerned that like it seems like one group of folks aren't talking to the other group of folks. And we've been talking about this with a lot of the push for health equity, anti-oppression, racial justice. Those of us who've been in the work for a long time and can remember back to maybe even before this work was really evaluated and funded very much. Some of the stuff that people are like, we're doing this thing. And I'm like, this is great, but also like, wow, like we're getting back to some grassroots stuff that started this work. And so there's a great, like kind of in some ways a full circle moment, but also, yeah, there's a lot of stuff that isn't new. For folks who've been in, like you said, like sociology, community psychology, community, grassroots community development and community organizing. And yeah, it's always interesting how the worlds just don't seem to be talking to one another. I don't know if it's the world is the right, but like the entities kind of aren't talking to one another. Thank you for sharing that. Thomas is sharing that every state except Texas, interesting, has a statistical analysis center. Our whole job is collecting and analyzing criminal justice data. Highly recommend reaching out to the SAC in your state to see if they can be a resource for you. And then posted the link to the national directory. Thank you for doing that. Got about 15 minutes left if there are other folks who have things they want to share. Marissa posted, I believe some state RPE programs have included social norms questions on either their YRBS or the BRFSS, Behavioral Risk Factor and Youth Risk Behavioral Survey. So North Dakota comes to mind, but I think there are others as well. Is any state on the call, including social norms questions? I feel like maybe Maine. I remember working with folks in Maine to revise their YRBS. I'll have to go back and look because they were wanting to get a lot more of that type of data out of their youth risk behavioral survey. Speaking of which, we have a blog post coming out today about the new YRBS data specifically to sexual violence. I have a lot of thoughts about that. I don't know. That's sort of a similar, but also maybe a different conversation. I don't know if anyone else has been sitting with that data or listening to any podcast or reading blogs where they're kind of digging into that a bit. It's been interesting. And I'm speaking about the new trends report that CDC put out about 2021 youth risk behavioral survey data and looking at a 10-year span and the impact of COVID, all of the things. Looks like Mina is sharing, we're trying to add gender norms questions on the California BRFS. Still working on it. Yes, please keep us posted on that. Thanks, RH, for posting the link, the OJP link. Jesse saying they'd appreciate some information about norms questions on the YRBS. Louisiana is one of the few remaining states that don't allow asking about sexual behavior. Yes. Or that, including sexual violence. Our state law banning it also bars any Also Bar is asking about values related to sex, and they include sexual violence in that. Wow. Thank you for sharing that, Jesse. Yeah, I know there's some other states. I was on Instagram doing some searching of like what people were talking about with the YRBS. I was very thrilled to see my cousin's daughter, who is a young teenager, sharing information about it on her Instagram with her friends, and got me kind of into a little bit of a rabbit hole on Instagram. But I was seeing other states popping up, like basically using the data to, and the new trend report to call for more, well, first of all, some participation in the school districts who aren't participating in YRBS, to get them to participate, in states that are pushing back on some of the questions and have not included them. And Jennifer shared a link to North Dakota's Burfus state added questions info, sexual violence attitude survey data. Cool. Thank you for sharing that, Jennifer. That's awesome. I'm gonna make a note of that. And yeah, RH stating they won't be doing YRBS in Florida, at least no time soon. So sorry to hear that, but totally hear that. Patrick, possible to reframe those questions so that they're about healthy relationships instead of sex? Question. And Thomas is also stating, same in Idaho, the state just decided to drop the YRBS last year. Iowa no longer doing YRBS. This is really discouraging. I'm so sorry to hear this. Dory, we helped a youth-focused organization develop a social norm survey focused on SVP in Michigan. Data are nearly ready for sharing. Oh, that's great, Dory. Thank you. We'll look forward to hopefully being able to see that data soon. Yeah, this has really opened up a good discussion about the data that is available or maybe not available for us to use. Some thoughts about new avenues to go down. Thank you, RH, for kind of pointing out those related yet not really connected yet fields, or people aren't making those connections where there need to be connections. Jesse stating there's a question about dating violence, which is good, but it would exclude sexual violence outside of relationships. Yeah. Yeah, I know some states we were working with, a couple of states. I want to say, I know Maine was one. I believe there was another one when they were sort of like trying to get in there when they could, when there was a good political moment to do so. But I fear that some of those may not still be in place depending on who holds the power in the state now. Does anyone have any other resources or things that they want to share around health equity? I will go ahead and share the next slide, because if you have, so it sounds like we've got some follow-up to do. We've got a nice long list from the chat of things that people have shared, some questions that have been asked by folks. So Mo and I will work to get this information and the recording and everything to Sally. And when she comes back, we'll get those things out to you. In the meantime, if you have things that come up or questions, or you're like, hey, someone shared this thing and I can't remember who it was, or what was that other link, please feel free to reach out at prevention@nsvrc.org. That will go to Sally, Mo, and I. So we'll definitely see it. If you have feedback about today's gathering, we'd love to hear that as well. Still got a few minutes if folks want to hang on, or if people need about 8 minutes back in their day, we can also we can also end early, but I don't want to do that if there are still people who want to share or ask questions. It's like folks are thanking folks for sharing. Yeah, thank you so much. There's a lot of great, I have an entire page full of notes, even though I know this is in the chat and on the recording, I still want to write everything down. Okay, thanks. And RH shared the National Conference of Juvenile and Family Court Judges, has some good data and information. There's a link there. Ooh, a lot of good stuff. Mo, do you have anything else you want to share or add before we?
No, I don't think so. I really am just thinking, I'm appreciating the talk about like the data, and it just makes me think about how so many of these fields are so connected, and yet the way I feel like it's a real funding thing where like the funding streams go in a certain way and then it all gets disconnected and then we don't talk to each other and then we don't know the data sources or share the data sources, and it's like such a frustration of mine. So I'm glad that that was brought up, and I don't know, I really like meeting with all of you. This was really fun, and thanks for being here. Yay.
Thank you. Yeah. Oh, funding driven divisions. Yeah. So I'll just say, thinking really, so I've had to, for this blog post we've done, I really dove into the YRBS trend report, and I started thinking about the pull away from schools with our PE funds. And I'm like, oh no, because the entire report is really about School Connected. I mean, it's the messaging we're getting from the division at CDC is that, you know, schools play an important role, and, you know, healthy youth development programs and social and emotional learning programs. And I'm concerned that a lot of states have, you know, kind of been directed to shift there, which is good. Again, like diversifying the funding and programming and all, it's not a bad thing. I just wonder if there'll be now kind of a conversation about maybe not doing that at some point. I don't know. Just thinking all these things and the real big push for school connectedness and interventions and training and programming for students. Just an interesting piece of information, but yeah. You mean we might have overcorrected, Patrick? Shocker, maybe. I'm just, this is Jen thinking, but yeah, thanks, Dory. Yeah, Mo and I were happy to step in. RH, thank you. Research juveniles and children is almost impossible in some states due to parental rights legislation, which has its pros and cons. Yeah, good point. Well, thank you all. This has been a really nice opportunity for me and I know for Mo to be able to join you all, and hopefully we'll see you at the next meeting, and Sally will be back, and we'll make sure that you get all the things from the meeting. And again, feel free to reach out to us if any questions or feedback come up or you need anything. Even with Sally being absent for a little bit longer, Mo and I have stepped in and can help as best we can. We can muddle through it together. So thank you all. And I hope that you all have a really great rest of your Wednesday. Take care, everyone.
Yeah, thanks everyone. Bye.
Thank you. Bye-bye.
Bye.